afternoon. Today, unfortunately, we do not have an American Sign Language interpreter, and we apologize for that. But we'll get on with the thrust of today's media briefing. Well, we made it through the halfway point of what has been obviously a very difficult year, and we're glad you're still with us. This particular week has been a critical one in our response to the pandemic, and before we head off into a long holiday weekend, we want to summarize where we are and where we're going. This week we took specific actions to slow the resurgence of coronavirus in our region by closing bars, wineries, and breweries that do not serve food. In addition, we imposed a 10 p.m. curfew on restaurants and bars that serve food with alcohol and took other steps to prevent people from lingering and relaxing their social distancing. We've taken these steps specifically to target the growing outbreaks in social settings and the rise in cases in young people who are going out more and letting their guard down, which is adding to the spread of this virus. The fact is, we've seen an increase in positive cases, increased hospitalizations, and an increase in the use of vital ICU beds that we're trying to preserve. We simply cannot continue with these growing trends, and we had to take action. Today, Governor Newsom announced a rollback of activities in counties that are on a watch list because they have gone into the negative zones on several key indicators. The county of San Diego is not on that watch list yet, but the recent comeback of this virus is pushing us closer to that watch list, and we want to avoid that if we possibly can. If your car is speeding down the road toward a cliff, you hit the brakes. We are hitting the brakes now to avoid going over that cliff. Today, Supervisor Fletcher and Dr. Wooten will go into more details about the state watch list and the data that is driving us there. After they speak, we have two very special guests from UC San Diego. We have Dr. Francesca Toriani, who is the Program Director of Infection Prevention for UCSD Health. Some of you may recall that she joined us at our briefings earlier on this pandemic. We also have Patty Mason, the CEO of UCSD Health, with us today. They are going to give us a better understanding of how coronavirus is affecting our region. Finally, we'll get to your questions and answers, and then we'll wrap it up. With that, let me bring on Supervisor Fletcher.
Thank you, Chairman Cox. Today, the Governor of California turned the dial significantly in 19 counties throughout our state, representing more than 70% of the population. He did this because of the significant increase that we've seen in California in cases and percentage of positives and hospitalizations. He did it because there is a need to now reflatten the curve. At the outset of coronavirus, we came together as a community, every faction, every region, every community, every political party, and we came together in a spirit of solidarity. We did a tremendous feat in flattening the curve. Because we were united, we understood the consequences, and we took action. Today is a day that should be a stark reminder that we have to summon that same spirit, that we must now once again in San Diego County come together and flatten the curve. It should be abundantly clear to all of us that coronavirus is real, coronavirus is serious, and coronavirus is not going away. And so as we move forward as a region, we have to move forward with the mindset and understanding that this is the new normal that we've talked about for so many months. You go all the way back to April, we talked about it being a month of action to flatten the curve. In May, we talked about it being a month of adapting. And we have to really recommit and refocus ourselves to that mindset of adapting to the reality we face. Adapting to a reality where physical distancing, face covering, hand washing, and daily monitoring of metrics and triggers and what is open and what is not is a part of our life until we get to a vaccine or therapeutic treatment. Our aim from the beginning of the reopening process was to have a smooth and steady recovery, and we're a little off track on that now. As you can see with the metrics and indicators in the recent days, and you can see with what's happening at the state, the reality is we're going to have to stay in line, not with stopping completely the spread of coronavirus, but slowing it to a manageable level to ensure the integrity of our healthcare system. San Diego County is the only Southern California county that was not forced to take action by the state of California today on their watch list. And I think that is in part due to our proactive steps. We were one of the first counties to take action, one of the first counties to have mandatory face coverings. And I think that compared to other Southern California counties, we continue to do well. But the reality is just because we were not placed in that enforcement mechanism posture today by the state of California does not mean that we won't be in the coming days. And you're going to hear a fair amount today to help understand the state watch list process. But essentially what it is 6 indicators or metrics that the state of California has, which are all indicators and metrics that we track every day. If you trigger beyond the threshold that has been outlined by the state of California, that's a 2-step process to get on the watch list. The first is you get flagged as being beyond the threshold that they've outlined. It's essentially a flagging or warning. If you have 3 consecutive days of having one of your metrics triggered or flagged or in the warning area, then on that 4th day, you go on the watch list. If you stay on that watch list because of any of those metrics for 3 days, then the following day is when you will have to take action. Here in San Diego County, we first hit the flag or warning period on June 30th related to our number of cases per 100,000 residents. We hit that on the 30th. We hit that again today on July 1st. If we hit that tomorrow, that will be our 3-day warning period. And the following day, July 3rd, would start our presence on the watch list. If we remained on the watch list for 3 consecutive days, July 3rd, 4th, and 5th, then on July 6th, we would be forced to take the enforcement action, which would be a 3-week pause on indoor activities in the entities outlined in the governor's order. So again, it is a little complicated, but essentially to get on the state watch list, it is a 2-step process. Step 1 is you trigger above in any of those 6 categories for 3 consecutive days. Then on the 4th day, you actually move from the warning list onto the watch list. If you remain there for 3 consecutive days, then the day after that is when you are forced to take the action the state of California outlined for 19 counties today in the state of California. Obviously, in San Diego County, we don't want that to happen. We would like to see our numbers improve in the next few days. We would like to avoid that. We want to continue to have a smooth and economic recovery as possible. But this is a part of the new normal and the realities that not just San Diego, but every county in California faces, which is a daily monitoring, measuring, tracking your impact, and even more than that, the daily effort we all have to do as a community to really come together, to adhere to the guidance that's been put out of a desire to save life and out of a desire to keep our economy moving. And so we continue to work on issues of enforcement. We've asked law enforcement to consider increasing their enforcement. We're doing everything we possibly can in raising public awareness and communicating the significance and the seriousness of the challenges we face, and working with the business community to make sure they're doing everything they can for businesses that are open. But the reality is this is the danger and challenge that coronavirus faces. And again, it's not just us here in San Diego, and it's not just in California. You have states across the country that are forced into positions of reclosing things that have been open, and that's the last thing that we want. So our hope is we can move forward very mindful of the challenges, very aware of what each and every one of us have to do to play our part. And in closing, before I go to the charts, that we can summon that same spirit that we had in March, where everyone was united and moving together, recognizing the danger, recognizing the reality of the situation we face, and recognizing that each and every one of us has to play a part as a region in our daily fight against the spread of coronavirus. With that, we're going to jump into our charts for today, give you a quick update on the regular ones, and then also begin to walk through the state metrics, the 6 that they monitor, and then turn it over to Dr. Wooten, who has a great graphical walkthrough of the situation I just explained about the 2-step process on the state watch list. We'll begin first with our T3, testing, tracing, and treatment. You can see today we're reporting 7,825 tests are being reported. There has been some discrepancy between our test and the test reported on the state of California's website. It's a technical issue that is being resolved, and we hope that their website is updated soon. But you can see our 7-day average now at just short of 8,000. Again, our contact tracers and the slight uptick in the utilization of our public health treatment rooms. Next, we will go to our daily percentage positive. Here you can see today we're reporting 474 new positive cases today out of the 7,825. That is a 6% percentage of all testing done that came back positive. And again, you can see the purple line there and the significant uptick that we've seen going back to June 19th, where we hit a low, and the significant climb that we've seen there. Our rolling 14-day average is now 4.5%, but it has been significantly increasing over the course of the last 10 days or so. Daily hospital census is down just a little bit from yesterday, ICU and hospitalizations. But again, if you go back to the 19th, you will see we are still on an upward trajectory on hospitalizations. Here you see the total COVID hospitalizations and then total non-COVID hospitalizations to give you a snapshot where our region is in terms of total hospital system capacity at 4,054, sort of that 80% line of 4,863. Here you see our ICU bed utilization. We're currently utilizing 65% of our ICU beds in our region. And then this final chart here, and Dr. Wooten's going to spend more time walking through this. These are essentially the 6 state monitoring metrics. The first one is the average number of tests per day. This is per 100,000 population. We are currently averaging 191 in this category. The state's website, due to some technical glitches with reporting data, represents a different number. We're working with the state of California to make sure their website reflects the accurate data that we face here on the ground. The second one you'll see there is the cases per 100,000, and we are over this. This is the one that has put us in that flag category now, today being our second consecutive day in that flag category, and this is the one that we are most concerned with in the immediacy. If we have a third day here, then that would get us through our 3 warning days and would put us on the watch list starting July 3rd. If we remained there for this metric or any other metric were to trigger for 3 days, then we would have to take action. The third one you see there is the percentage of testing positivity. Again, 5.5. We're below what we need to be, but again, there's a discrepancy between the state website in terms of communication of data, but we're working to resolve that. The next one is percentage change in the 3-day average of COVID hospitalization. ICU beds currently available and ventilators currently available. Again, these are all metrics that we track that are a part of our broader triggers, but these are the 6 that the state uses for the flagging or warning, and then placement on the watch list. And then if you stay on that watch list for 3 days, then you have to take the remedial or corrective actions that were outlined today for a number. That concludes my section of the report. I'll now turn it over to Dr. Wooten for her public health officer's update.
Thank you, Supervisor Fletcher, for your virtual update, and welcome everyone to today's press briefing. Today I will start with the reported COVID-19 statistics for San Diego County, and currently there is a total of 14,623 cases, which is 474 more cases than reported yesterday, another daily high number of cases for us. This total includes 372 deaths, with 7 new deaths reported since yesterday. 7,447, or 51% of these total cases, are female, 7,143, or 49%, are male, and only 34 individuals have no gender identified. 1,791, or 12% of the total number of cases, have been hospitalized, and this includes 490 individuals that have been admitted to the ICU, and this number is slightly over 3% of the total number of cases and 27% of the total number of those hospitalized. Regarding deaths, there are 372 total deaths, which represent approximately 3% of the total number of cases. 42.5% were female, 57.5% were male. 352, or 95% of the total number of deaths, had underlying medical conditions, and 19 or 5% of the total deaths had no underlying medical conditions, and one is still pending confirmation. The 7 new deaths that we reported today occurred between June 26th and June 30th. And of these cases, the age range was from 57 to 89 years of age. 3 were male and 4 were female, and all had underlying medical conditions. And our sincerest condolences and sympathies go out to these additional new cases that are being reported today that lost their lives due to COVID-19. Now, the following set of slides show test cases, hospitalizations, ICU admissions, and death data over the past weeks. And the week's information is on the left side, and then for the past 14 days or more is on the right side. This slide shows the daily number of COVID-19 tests by date reported. So you will see that in the past week and a half, we have had record high of numbers of cases reported daily, with the exception of 6, 17, and 18, due to numerous batches that were submitted and catch up on those days. On the next slide, we have new cases by date reported, and as you can see, an increase since June 22nd, with the exception of yesterday at 317, but all of these daily total number of new cases are above 300. Next slide shows the number of hospitalizations, and Dr. Toriani will speak more about that when she speaks. This shows on the left side hospitalizations by week, and we see in the latter part of May, first 2 weeks of June, there was some decline from the previous weeks, but then we've seen, with the exception of one day, kind of an increase in the number of hospitalizations. And the next slide shows the number of ICU patients, which is part of the total number of hospitalizations, and we see those are tracking to be a little higher in the past weeks. Next slide shows cases by death. And as stated before, usually on the weekends, the numbers are low or 0, but they increase. And deaths always lag behind cases and hospitalizations. If we look at the kind of the grouping, though, if the rest of this week continues to trend, as well as last week, we had a higher number of cases in the middle of last week as well, compared also to this week. Next slide shows, this is the epi curve by illness onset. And we can see that we thought we had peaked in by the end of April, the beginning of April 20th through May 8th, but with reopening of the various industries and venues, we now see increased number of cases. And under the, just as a reminder, under the curve there, the box on the far right, we know we will have more cases there because that is the incubation period. So that will change, that box will move over every day. In the next slide, I want to now talk about triggers. And trigger number 2 is community outbreaks, and the other elevated trigger today for the first time is case investigations. And I'll walk through both of those in a minute. As we know, trigger number 2 is the target is 7 outbreaks over the past 7 days, and today we are at 13, and we'll show a table of what those outbreaks are and the settings that they're in. And number 11, trigger number 11 is case investigations, and this has decreased because of the increasing number of cases that have occurred over the past 7 days or so. If we go to the next slide, This shows outbreaks from June 17th through June 30th, and the 7-day period is June 24th to June 30th. And you can see under that bar, there are a total of 13 outbreaks, community outbreaks. And the next slide shows the settings, and it ranges from businesses to restaurant bars, restaurants only, healthcare, grocery, as well as private residents and food sources, manufacturers, and as in the last three, we have a restaurant, a food source, and a business. Next slide. So Supervisor Fletcher talked about the state metrics and monitoring metrics to place in counties on a watch list. So counties are placed on the state watch list when any one of these metrics is abnormal for 3 days in a row. And in addition, if there are other metrics, even if you fall off on one particular metric and you have another metric that's abnormal, that keeps you on the watch list. But in the next slide, well, actually, before we go to the next slide, the case rate is where we are abnormal, and the metric is not to be greater than 100 per 100,000 population for the past 14 days. And as you can see here, we are at 100.5. As Supervisor Fletcher stated also, the metrics with the asterisks, we are still working out with the state in terms of them having all of the tests that are reported locally in San Diego. But for right now, my focus with you will be on the case rate. Going to the next slide, this explains the process. So yesterday was our first day, but I'm just going to explain in general. If you're on if you have an abnormal metric, any one of those 6, that's day 1. You will get an email from the state saying that you've been flagged. And then if you continue to be meeting that metric or being abnormal, on the second day, you'll have a conversation with the state so that we can look at any mitigation strategies. On the third day, if you are still abnormal and that metric is red, on the 4th day, you will be placed on the watch list. And so at the bottom, the example is that on June 30th was our first day, July 1st, today is the second day. We anticipate, because of the increased number of cases, that we will also be abnormal for July 2nd. And this means that on July 3rd, we will be placed on the watch list. Now, if after July 3rd, with being placed on the watch list, if we continue to be on the watch list for the next 2 days, that's a total of 3 days, and then we will qualify to conform to the guidance that the governor gave today at noon, that 19 other counties, and actually all of the counties that are surrounding us are having to adhere to that guidance. So that's what things would look like, and we anticipate that this case rate will continue to be abnormal because we continue to have increased number of cases. So I just want to emphasize, re-emphasize, that the county is seeing increased number of cases, as we've shared, and increased hospitalizations, and Dr. Toriani will talk about that shortly. All of these factors have caused us to have an increase in our triggers and also to have a metric on the state's monitoring list to be abnormal. These factors are evidence that the pandemic is not over and the virus is still widespread throughout our community and causing increased number of cases. So it is vital that we remember that our actions can have power and can save lives. We want everyone to wear their face coverings, to adhere to sanitation and hygiene practices, maintain physical or social distancing, and refrain from gathering, particularly with individuals that are not part of your household. So thank you for your attention, and now I would like to welcome to the podium Dr. Francesca Torriani.
Thank you, Dr. Wooten, and it's a pleasure to be here, even though the circumstances are clearly not the most favorable. We are seeing a higher number of admissions in acute healthcare. In addition to that, we are also seeing a higher number of diagnoses of patients coming into care to get diagnosed and then not needing a higher level of care. We're also seeing an increase in the number of healthcare workers who also are becoming symptomatic. So this is a manifestation on what is happening in the community, and that is straining all healthcare systems, whether inpatient or outpatient. And what we see as a common thread of these symptomatic individuals is that there was a transmission that was not recognized, so that this transmission occurs mainly when we're not symptomatic, and this transmission occurs when we're not physical distancing, and this transmission occurs when we're not masking. And therefore, it is vital that everybody in this community helps curb the spread of infections, helps break the chain of transmission. We need everybody to be responsible, because what is at stake, even if I may not be symptomatic, I could give this to my mom, I could give this to my grandmother, I could give it to a friend who has a pre-existing condition, and that person could die. So it is vital that we have this voluntary use of really physical distancing and wearing a mask when we are with other people, and keeping really that physical distancing, keeping it with anybody with whom we interact out of our household. Any questions? I mean, what we're seeing in the hospital is people who are coming into the hospital are people, as Dr. Wooten said, who have pre-existing conditions, so who have complications. We know that this is about 12% of people who are infected. So the other 70-something are out in the public, right? And maybe are not aware that they are infected, and so transmitting. Thank you.
Good afternoon. I'm Patty Mason, and I'm CEO of UC San Diego Health System. I'm here not just representing UC San Diego, but also the other health systems in the region. What I would want the community to know, and I think you would be proud of what's happening across our health systems, is how hard we're working together to coordinate and respond to the pandemic. We meet weekly with the county leadership, with Dr. Wooten. We've been working with her and her team on some of the key metrics that Dr. Wooten has gone through today. So for things like ICU usage, underneath that particular metric, we've been talking about what that means in terms of, do we have enough critical care physicians? Do we have enough critical care nursing? Do we have enough critical care respiratory therapy? And we're having all of those conversations together as regional health system leaders in order to ensure that we're sharing information and we're making sure that we can handle what's to come. Now, the message I think we'd all like to share with you as healthcare leaders is that we're very, very concerned about the trajectory of this pandemic. We are very supportive. We were supportive about beginning to open up parts of the economy. and we would like to continue to support that. But I need to tell you that we started this journey 147 days ago when the first flights came in from Wuhan, and we started taking care of patients that had coronavirus. And the teams are tired. And we're seeing, we saw a plateau, and yet you see the graph in front of you. We were actually very optimistic that the original public health actions were working really well, and we were beginning to see a plateau in mid-April to early May, and then starting to drop a little bit. I got really excited when we had less than 30 patients, COVID patients in the health system, but it spiked back up, and that's true whether it's Scripps Health or Kaiser or Sharp or Palomar or Tri-City or Alvarado or Paradise Valley, et cetera. We are all seeing these increases in inpatients, this increased demand of critical care, and more patients turning positive and more healthcare workers turning positive. So we are really lockstep with our county leadership and our county public health officer to say, as Dr. Toriani said so strongly, please follow the social distancing and public health initiatives. We have gotten unbelievably wonderful cards and notes and thoughts and prayers from our community, from kids to seniors, about the care that we're providing as healthcare givers. The most important thing you can do to respect us as healthcare workers and healthcare leaders is to mask, to socially distant, to follow the policies that the county is putting into place. And again, I share that not just as UC San Diego, but as a regional group of leaders for healthcare. Thank you. Dr. Supervisor Cox.
We want to thank Patty Mason, the CEO of UCSD Health, for being here today, and also Dr. Toriani for her expert opinion and testimony today. With that, we'll go directly to the questions. Let's go to the first one.
Yes, John Carroll with KPBS. Will you please state your question?
Hi there. Thank you. With the stated ability, as you guys have mentioned many times, of the county to move beyond the state and being more conservative with things, given also what Patty Mason just said with the rising cases here and that she's very, very concerned, and then given the fact that every county surrounding us in Southern California is not doing well, why not just dial back now here? You're probably going to have to do it anyway, so why not get a few days on it and dial back now?
I'm going to let Dr. Wooten go ahead and respond to that.
So thank you for that important question, and maybe you missed yesterday's briefing and the briefing on Monday, but that is in fact what we have done. I stated that because all of the counties around us are on the state's watch list and will have to shut down the various venues that we spoke about, restaurants, wineries, breweries. We did the same thing, and what we did, as stated yesterday, is we put a limit on the closing time, which would be 10 p.m., and then all staff would have to be out by 11 p.m. So businesses would be closed, those businesses would be closed from 10 p.m. to 5 a.m. So we actually have done that. Thank you.
Well, Doctor, if I might follow up, I'm talking about the guidance that now the other counties have to follow, in that the indoor operations at those specified businesses have to close completely, not for a certain amount of hours.
Yes, well, we anticipate that we will be on that list, but we're going through the process here. And if these various businesses, as was stated yesterday, will need time to come to the realization that they will be closed, they need time to do that. But we anticipate by the weekend that we will be on that list as well.
Thank you.
You know, I think with that last question, I think it all gets back to the point that if we could get everybody in this county, and we've had pretty good cooperation, but if we get everybody to wear facial coverings, to maintain social distance, to not go out of their home unless they have essential business to deal with, we wouldn't get to those thresholds. Let's go to the next question.
Brandon Lewis with CBS 8, please state your question.
Yes, I wanted to ask about the community outbreak from a food source. The CDC has said there's no evidence to support transmission of COVID-19 that they know of from a food source. So I'm wondering if you can elaborate more on this food source for the community outbreak and if San Diego County has evidence to the contrary of what the CDC has said.
Okay, Dr. Wooten's going to respond.
In the table, if staff can bring that up, when we talk about food source, we're not talking about it as the source of the outbreak, but the type of setting or business that the outbreak has occurred in. So that's what we mean by food source, not that that is the cause of the outbreak. Does that make sense?
Can you distinguish then what is the difference between a restaurant in there and what's the difference from a food source then?
Well, there are food manufacturers from manufacturing hot dogs or various other types of foods, manufacturing meat or fruits or distributing fruits. That's what we mean by food source. So these are businesses that are manufacturers and distributors of food sources.
And so if you could just clarify just to make sure that there's still no evidence that you can track the virus from food.
That is absolutely correct. No evidence that food itself can transmit the virus. The virus is, a person is infected when it gets into the respiratory system. So again, the utilization of the word or the term food source there has nothing to do with how the infection is transmitted. It is specifically, and if you go back to that slide, talking about the type or setting or location of the business. Thank you.
Thank you.
Okay, next question.
Yes, Lori Weisberg with the San Diego Union Tribune. Would you please state your question?
Hi, thanks for answering this question. I'm trying to get a little more specificity on some stats that I saw that LA County is providing, but I haven't seen that San Diego County is providing. And it has to do with the county's inspections of bars, breweries, wineries, and other restaurants and businesses in terms of the inspections. I was emailing back and forth with Mike Workman earlier today, and he got me what he could, but it wasn't the specificity I hoped for. In LA County, they said that their inspectors found that 49% of bars and 33% of restaurants in the county were not adhering to social distancing protocols in the last week, and similarly high percentages for wearing masks and face shields. I asked that of Mike Workman, and he was able to get me that just said that the majority are hearing, and that was the end of that. Why can't I get the kind of specificity and stats that LA County health officials are providing for their inspections of their restaurants and bars and breweries? I'd like to know more about the level of compliance, but clearly that's what's driving the rising number of restrictions on this industry. So could we get those kind of numbers for San Diego County?
Okay, Dr. Wooten's going to respond.
So those numbers in Los Angeles most likely came from the Department of Environmental Health, so we can reach out to that department and determine if that's something that can be collected. But to my knowledge, I am not aware of that information being collected, but we will reach out to see if it's possible. That's the only information I can provide you with today. Thank you.
Thank you.
Okay, next question.
Will Huntsberry with the Voice of San Diego, please state your question.
Hi there. So I was wondering, I think you've said the answer to this before, but could you go over again what constitutes a community outbreak? You said we had 3 new ones today. Does that mean there has to be 3 transmissions, or like what is the point where it's called a community outbreak?
Okay, Dr. Wooten's going to respond.
Thank you, Will, for that question. So the definition for the outbreaks are determined by the Council on the State and Territorial Epidemiologists. as well as working with the California Department of Public Health. So today, because it could change, the definition for community outbreak is 3 cases from different households. And so that's the definition. So if we have or report an outbreak, they have at least 3 cases that are from different households.
Got it.
Yes.
And the community outbreaks number, it does not, like, from the list you provided today, that
Yes.
doesn't include congregate care settings like nursing homes, right? How many active outbreaks do we have in congregate care settings?
Congregate care settings, and I can go get because I have the actual numbers, but I know that we currently have 20 active outbreaks in SNFs, skilled nursing facilities, and about 28 or so in non-skilled nursing facilities that are long-term care nursing facilities or are behavioral health type facilities, but people are residents there. So we follow cases in staff and residents from those 2 settings. So when we report outbreaks, they are in 3 various settings: SNFs, skilled nursing facilities, non-skilled nursing facilities, and community settings. And each of those categories have different definitions. Now, particularly for SNFs, you only have to have 1 case. Previously, it was 2, but now 1 case constitutes an outbreak.
Got it. And I had one more question, if you guys would let me. And this has to do with contact tracing. I don't know if Dr. McDonald's there today, but
He is.
I gather that he is. Okay, great. So my question is, like, say for instance that you've got contact tracers and they're talking to people who are confirmed positive, and one person says, "Oh, I went to People's grocery store in Ocean Beach," and then they talk about the other places they went, and then you have another random person who also, is a positive, and they're talking about all the random places they went. It turns out they also went to People's in OD. Are you like tracking single mentions of places people have been? And would the contact tracers be able to do that kind of fine-grained of a level of zeroing in on an outbreak?
That is a great question, and you actually stated it perfectly. That's exactly what we do. When we get information from each individual, we find out where they went, not for a brief 5 minutes, but in a specific, particularly indoor location or outdoor locations like a protest, for longer than a period of time that they could be having close contacts with others, i.e. 15 minutes within 6 feet. And we make that list of all the places they've been while they were potentially contagious and where they could have actually contracted the illness. And so we compile those lists and we actually do a cross-match and look for places that match. And that is, in fact, how we are able to discover some of these locations, particularly when it's patrons of a place that has been identified as a community outbreak. The employees are a little easier for us to cross-reference because when we have an employee in a location, we'll often go in and test the other employees working with that employer, and we'll reach our threshold of 3 from different households, as Dr. Wooten mentioned. But we also additionally are adding the information about patrons, and those 2 together give us a full picture. So I will say that of the outbreaks that Dr. Wooten put on her list, there are several that have the combination of both employees and patrons of that location. And you've actually described precisely what we do. We gather the data and we cross-match it.
Thank you for that, Dr. McDonald. Yeah, I think that's it. Thank you, guys.
Okay, we have one final call-in question.
Paul Sisson with the San Diego Union Tribune. Please state your question.
I want a little clarification on when we would end up on the state's watch list if we continue to see triggering events as you guys described today. I think in the initial intro, it was said that we would end up, if we continue going in the same direction, on the watch list on Monday, July 6th. And I think Dr. Wooten said in one of the earlier questions that she expected we will be on the watch list by the weekend. So can we clarify which it is? Is it Monday or is it this weekend?
Okay, Dr. Wooten will respond.
So Paul, thank you for paying attention. So if the staff can bring that slide back up, there's another slide that I wasn't able to show you, but July 6th would. So by the weekend, July 3rd, kind of going into the weekend, but yesterday was our first day of having the abnormal at the bottom of the slide. Drive your attention there. The case rate was abnormal. So today, it is abnormal again. We will have a phone call with the state tonight. Tomorrow, we anticipate that it will be abnormal again because our total number of cases are increasing. So that's 3 days in a row. If that holds on the 3rd, which is Friday, we will officially be on the state's website as being on the watch list. Now, there's another slide. Unfortunately, we can't get to that, but it basically shows that for July 3, 4, and 5, if we continue to be on the watch list, we need to be on the watch list for another 3 days after the 3 days that I've just, actually it will be another 2 days because, yes, July 3rd it would be when we would be on the, there you go, on the state's public watch list. At the bottom, so then we would need to continue to be on the watch list, July 3rd, 4th, and 5th, and that's 3 days, another 3 days, and then that would make us eligible for the governor's restrictive measures for the next 3 weeks, which would take us from July 6th through July 27th. Does that answer your question?
Yeah, so we would be on the watch list, but we wouldn't really suffer the consequences that other counties are already suffering until after the July 4th.
Yes, until we are on it for another 3 days through July 5th, and then on July 6th, we would be in the same group as the 19 counties that were announced today.
Okay, and I had one other question. We received a tip that 8 employees at Sequan Casino here in town have tested positive for COVID-19. Is that something that you can confirm? Is Sequan one of the outbreaks that you've announced so far?
I do not have any information about that at this time. Dr. McDonald is coming up to the mic. Maybe he can shed some light on that.
Thank you.
Sure. None of the outbreaks that have been described by the county involve any of the tribal lands, and we are in active communication with our public health authorities on each of the tribal lands. We do that routinely whenever we get a notification of any communicable disease, and we have not identified with them a specific outbreak at this time. So I would, if you have that kind of detailed question, I would actually refer you to them to be able to answer that type of question.
And to be clear, Dr. McDonald, 8 employees would constitute an outbreak unless they all happen to live in the same house.
Well, it would meet the surveillance definition for an outbreak, and that's important. Because, again, it's useful to keep in mind a number of factors. For example, the number of people that are involved, whether they're in the same households. But yes, it meets the surveillance definition that we use in the county and that is endorsed by the Council of State and Territorial Epidemiologists.
Thank you.
Okay, we'll now go to the first texted question.
Yes, and this one is from Chrissy Russo with Channel 5. What do you need that would best help stop the outbreak in San Diego?
You know, I'm going to ask one of our guest speakers today, Dr. Francesca Toriani, to come up and basically respond to that question, if she would.
A pleasure again. So this is very simple. Physical distance, 6 feet or more from anybody else. Mask, and remain within your household. So if you're out on the beach, that's great because there's plenty of air. But remain within your household on the beach and put a mask on when you're not swimming or doing other things, right? Protect yourself and just be in that mindset. It will help everybody.
Okay, next question.
This one is from Andrea Lopez with the Union Tribune. I've been speaking with venue owners for a story, venues that host weddings, quinceañeras, and other large parties. Some of these spaces have capacity for up to 300 guests. What stage phase do these businesses fall under? Many of these businesses tell me they are unsure of when they will be able to operate.
Well, actually, they would be in stage 4, and we haven't gotten to stage 4, and it's a question when we will get there. It certainly won't be before the end of July, and, we'll have a better idea maybe then. But at this point in time, they are not permitted under the governor's orders to be operating. Next question.
Okay, so there's a question that's very similar from Mark Mullen with NBC7, as well as Guillermo Mendez from Univision. And they both want to know the following. With beach closures in Los Angeles County and restrictions in other parts of the state, including Orange County, along with residents in Arizona coming to San Diego for the holiday weekend, how worried are you that an influx of visitors will further spike local infections, and how can the county mitigate that risk?
Okay, Dr. Wooten, do you want to respond to that?
Well, thank you for that question, and we recognize that with all of the counties surrounding San Diego County being on the governor's watch list, and then the other coastal counties, Los Angeles and Orange County. And from what I know, and I can stand corrected, the only county that I'm aware of that's closing their beaches is Los Angeles, is Orange County and Ventura. To my knowledge, Orange County is not. Is that correct? So we don't know that Orange County is closing their beaches, but we do know that Los Angeles is. We have conferred with our legislators or mayors from the coastal municipalities in our county, and they feel that they can manage the enforcement of our social distancing and face covering strategies over the weekend. So we are working with them to do just that.
And I just want to quickly add that, again, we participate with our local counties in Southern California and communicate with each other quite a bit. And I'll say that there is a lot of strength and a lot of mutual support there, and both on the medical side, the public health side, and on the leadership side. And actually, it is a macroscopic example of what your neighbors do matter. And our neighbors, we expect them to be doing what we're doing, which is to protect themselves and to protect us. And so taking that general question and making it more specific, we would ask people to really, look at your own behavior, but also encourage your neighbors to do exactly the same thing. So I actually am not worried about our neighbors because I feel the same way about other Southern Californians as I do about San Diegans, that they know the right things to do, specifically the things that Dr. Toriani mentioned, and if we all do them, we will be protecting ourselves.
I just wanted to remind individuals that today, during the governor's press conference, he stated that the state beaches, the parking will be closed, but people can still walk on the beaches, but the parking for state beaches will be closed. And San Diego County is included in that list.
And Dr. Wooten, this last question is from Mike McKinnon with KUSI. Today, Governor Newsom said he wants to encourage good behavior for businesses and work with them and address the concerns that present themselves. What do you say to the business owners in San Diego County who you have forced to close down again before our county was placed on the governor watch list, that have been following all social distancing guidelines but cannot stay open?
So first of all, I'd like to say that that's been a very small number. And even with those businesses, they've been cooperative and have subsequently done or performed the necessary things to be able to operate again. Our purpose is not, we don't want to close down any businesses, but we have to maintain the integrity of the public health best practices that are recommended. And in general, most of our businesses have been doing a great job. Now, we recognize that we've had some problems and hiccups in Little Italy as well as the gas lamp, but those situations were rectified. So again, we would like to thank all of the various businesses for all of the great work that you've been doing to comply with the best practices that have been recommended as part of the health officer's order. Thank you.
Well, thank you all for participating. Before we wrap up, I want to provide some important information. Our County Administration Center, located downtown, had recently reopened to the public, but due to the rising number of cases that we are experiencing, we're going to close it again starting on Monday, July 6th, for the rest of the month of July. This is being done to protect our employees and minimize the spread throughout our workforce as well as the public. Our hardworking county employees are continuing to work remotely, so please visit the county website to find out how you can access the services you need. That website is sandiegocounty.gov. Excuse me. We were also hoping to reopen our county libraries this next week, but we are going to hold off on the previously announced reopenings. We will, however, keep libraries open that are designated as school zones. Those are primarily in East and North County. Because of the holidays, we do not anticipate holding another media briefing until Monday afternoon. Our communications office will send out any updates to the media, and information will be updated on our coronavirus website at coronavirus-sd.com. Lastly, let me just say this. We know that this is a great American holiday, and we're all going to want to celebrate it. We get that, but please do so safely and responsibly. Wear facial coverings when you go out and maintain your distance from others. Please don't hold large backyard barbecues. 2020 is half over, and this virus shows no sign of going away. There's no vaccine coming soon. There are no superheroes to save us. We are the only ones who can do that. We are the only ones that can end this virus. It's up to us and our individual efforts to help this virus from spreading. With that, we say thank you for your attention. Please stay safe, San Diego. Protect yourself and protect others. We'll see you on Monday at 2:30. Thank you.